Good evening, everyone. Welcome to very impactful paper presentation competition 2021, arranged by Axis Dental School, which is largest online platform for dental students. Axis Dental School, within this pandemic, created healthy environment of learning through online lectures, case presentation, and discussions. Thank you, Axis Dental School, for creating this platform. Our most popular online event of paper presentation is now ongoing. Today is 15th episode. Welcome again and bear with us. Today's topic is mechanical plaque control method. Here I am Dr. Suraya Rahman Papri, Dhaka Dental College and Hospital. I will be moderating this session with you. Now, I would like to introduce our Honorable Supervisor, Dr. Anupam Poddar Sir, Associate Professor and Head of the Department of Periodontology and Oral Pathology, Dhaka Dental College and Hospital, who is giving his 100% effort to enrich, spread the knowledge of periodontology like an one-man army. Thank you, sir. Today with us, here are our honorable judges and our guest, Dr. Balaji Monohar sir is present. He is principal and head of the Department of Periodontology, Kalinga Institute of Dental Science, Bhubaneswar, India. Namaskar, sir. Here with us, our honorable judges are present. Their excellence in the field of periodontology is admirable to all of us, and they are dream of us. I would like to introduce them as living legend of periodontology. Dr. Ganesh P.S. sir, BDS, MDS, periodontist, Tamil Nadu Government Dental College. Welcome, sir.
Thank you.
Dr. Ankita K. Kocheta, MDS Periodontics, Gold Medalist, Dental Studies Simplified. Namaskar. Dr. MD Shahidul Islam Shahin sir, Associate Professor and Unit Head, Dental Unit of Haja Yunus Ali Medical College. Welcome, sir.
Assalamu alaikum.
Assalamu alaikum.
Good evening.
Thank you for your valuable time. Now we have our talented dental students aspiring to learn more and explore the field of periodontology will be presenting their topics. Their team is named Gingiva, an interesting topic of periodontology indeed. It is the pink-colored keratinized mucosa that surrounds and protects the teeth. Interesting, isn't it? Our periodontology department sort of partly evolve with these gingival conditions and whatsoever. By the way, I would like to introduce our presenter, Asmatul Mahadi Luni, session 2017-18, City Dental College. Ilara Hossein Shanta, session 2017-2018, Sir Solimullah Medical College Dental Unit. Maimuna Noor, session 2017-18, Chittagong International Dental College. Welcome you all. Now I would like to invite Dr. Anupam Poddar sir to start this session with us. Please, sir. Would you like to encourage our participants with your kind words?
Thank you, Dr. Suraya Rahman Papri, the student of Dhaka Dental College, now is the intern of Dhaka Dental College, batch 2015 and 2016. Thank you for your nice moderating. First of all, I would like to thank the Axis Dental School and its event management team who do the just like the interesting and public-oriented and student-oriented session that will be may be helpful to our students who are the student of third phase. Third phase means fourth year PDA student. Today, 28 September, And today's topic is mechanical plug control method, and episode is 15. This is just we have arranged 16 episodes. Today is 15 episode, and the group name is Genjiva. Our judges are Dr. Ganesh PR, periodontist, Tamil Nadu Government Dental College, Hospital, Chennai, and Dr. Ankita Kotesa, MDS periodontist, gold medalist, dental studies simplified, and also Dr. Muhammad Chaudhry Islam Shaheen, Associate Professor and Unit Head, Dental Unit, Khaja Universal Medical College. I would like to thank all of the judges who are there. And also, I would like to thank Professor Dr. Balaji Manohar. He's a good friend of us. He always, when I introduce him, he try to attend our session, any session. And Professor Dr. Balaji Manohar is the principal and head Department of Periodontology and Oral Implantology, Kalinga Institute of Dental Science, Bhubaneswar, India. And our knowledgeable speaker, my dear student, Asmatul Mehadi Luni, Hilera Hossein Shanta, Maimuna Noor from City Dental College, Sir Solomon Medical College Dental Unit, and Chittagong International Dental College, Chittagong International Dental College, accordingly. All of are 2000 batch 2016 and 17. And all of our speaker already know the rules of this presentation, and our judges, each of judges carry 100 marks for each person and 100 marks for moderator also, and they give marks according to their pattern of judgment also. And hopefully this session will be very much interesting, very much enjoyable, and I request to all viewer and upcoming viewer who see the presentation would be helpful all. Thank you.
Thank you, sir. Thank you for your kind words. I would like to request Dr. Ganesh Pierce, sir, to say something about today's topic and its episode of this program.
Thank you for inviting me. This is my first time with the Bangladesh Perio Society. I hope to make this a regular occurrence. I am looking forward to your students' presentations because we have been exposed to all other university students, but this is the first time I'm interacting with Bangladesh Perio. So I really am looking forward to sharing of knowledge between Bangladesh and India. Thank you.
Thank you, sir. Thank you for your kind words. Now, I would like to request Dr. Ankita K. Kotecha, ma'am, sorry. I'm very sorry. Ankita K. Kotecha, ma'am, to talk about this program and encourage our students.
Very good evening, namaste. Thank you, Axis Dental School, for this wonderful interactive platform. I am really glad to be here again. And as far as the presentations are concerned, I am really sure the students are well prepared and will give their best shot. Just interested in discussing the data rather than judging anybody. We are all here to discuss the topic and learn something out of it. That's all. Take back some good data along with us. Okay. So all the best, all the students. Just be confident and do your best.
Thank you, ma'am. Thank you, ma'am, for your inspiring speech. I would like to invite Dr. MD Shahidul Islam Shaheen, sir, to talk about this program and encourage our students.
Thank you, moderator. Assalamu alaikum and good evening. I am happy to be here in this gorgeous and knowledgeable program. Hopefully, this program will be mostly benefited for the student in future professional career. And I wish all the students best of luck.
Thank you,
Thank
sir.
you.
Thank you, sir. Thank you for your kind words. Now, I would like to invite Professor Dr. Balaji Manohar, sir, for his kind word. Sir, are you here?
Good evening, Dr. Anupam, Dr. Shaidul, and Dr. Ankita and Dr. Ganesh from India. All the students who are here, Asmatul Mahadi, Maimuna Noor, Ilara Hussain, and moderator Suraya. Wonderful. I've been here so many times. I love participating with you all, and it is a very great thing that the students are presenting papers right from third BDS onwards and on Access Digital platform. Thank you, Access, for having me here once again. I wish all the students the very best. And as Ankita said, learning is a continuous process. We all are here to learn. Thank you.
Here with us, Dr. Didarul Alam Sir, Assistant Professor and Head of the Department of the OMS, Sherebangla Medical College and Hospital. He joined us, and I would like to invite him to share his expertise on this session and his kind words. Sir, are you here? Sir?
Hello, Didar. Hello, Dr.
Hello.
Didar. Please,
Hey.
please say something about this session.
Oh.
Hello, sir. Are you here? Sir? Welcome, sir.
Oh, thank you. Actually, আমার একটু দেরি হয়েছে এখানে জয়েন করতে, কারণ আমি এই মুহূর্তে ঢাকার বাইরে লঞ্চে অবস্থান করতেছি এবং আমাকে যে এখানে বলার জন্য খুঁজে হচ্ছে এটাও আমি এতক্ষণ দেখি নাই। আসলে এই কয়েকটা প্রোগ্রামে পার্টিসিপেট করতে পারা একটা আনন্দের ব্যাপার। আমাদের ডাক্তার অনুপম পোদ্দার অনেকদিন ধরে ওরাল প্যাথোলজি, পেরিওডন্টোলজি রিলেটেড টপিকস গুলো নিয়ে আমাদের স্টুডেন্টদেরকে এনকারেজ করতেছে, যাতে আমাদের একাডেমিক পারফরমেন্স এবং স্টুডেন্টরা বেনিফিটেড হয়। এই জন্য আমরা অ্যাক্সিস ডেন্টাল স্কুল এবং অনুপম পোদ্দার এবং যারা ওরাল প্যাথোলজি রিলেটেড পেরিওডন্টোলজি সোসাইটি এই ধরনের উদ্যোগকে আমি স্বাগত জানাই এবং আমি আরো সবার শুভেচ্ছা কামনা করি এবং আমি আশা করি এটার মাধ্যমে আমাদের স্টুডেন্টরা উপকৃত হবে এবং আমাদের যারা একাডেমিক রিসার্চ এবং তারাও তাদের নলেজ এন্ড আইডিয়া শেয়ার করতে পারবে। থ্যাংক ইউ for giving the chance to participate in this session.
Thank you. Thank you, Professor Dr. Balaji Manohar sir. And thank you, Professor Dr. Didarul Alam sir, for your kind words. Thank you. Now, the attractive part of this session is going to start. Be prepared, participants. A simple rule is to be maintained. Each participants will have only 10 minutes to show their presentation. I will remind you after 8 minutes to concise the presentation and get to finishing. Now I would like to invite Asmatul Mahadi Luni, session 2017-18, City Dental College, for your presentation.
Thank you, moderator. Please let me know. Am I clear?
Yes. Yes, dear, you are clear.
Assalamu alaikum and adab. Very good evening, all gathered here. He who puts his soul and heart is simplicity, others sustain dignity. Yeah, I welcome all the dignitaries on and off this session. On this special session, I would like to welcome you all for joining with me. Thank you, our honorable teachers, who are enlightening our medical science. Dr. Ganesh Pierce sir, Dr. Ankita Koteja ma'am, Dr. Muhammad Shahidul Islam Shahin sir, and Dr. Anupam Poddar sir. Now, I would like to introduce myself. I am Asmatul Mahdi Duni from City Dental College, session 2017 and 18. Today, my topic is mechanical plaque control method. I plan to say a few words about it. Here is my content. I decorate my presentation by following this content. My contents are definition of dental plaque, definition of plaque control method, mechanical plaque control method classification, A, toothbrush, ADA specification of toothbrush, history of toothbrush, and ideal properties of toothbrush selection. Now, let's move to the first part of my topic, which is about dental plaque. What is dental plaque? Plaque is a sticky film of bacteria that constantly form on a teeth. Here we can see some picture of dental plaque, which is yellow in color. According to WHO definition, plaque is a specific but highly variable structural entity resulting from colonization of microorganisms on tooth surfaces, restorations, and other parts of oral cavity, and consists of salivary component like mucin, desquamated epithelial cells, debris, and microorganisms, all embedded in a gelatinous extracellular matrix. Let's move into my next slide. Plaque control. What is plaque control? The removal of dental plaque on a regular basis and the prevention of its accumulation on the teeth and adjacent gingival surface. Now I would like to explain plaque control methods. It has two types, mechanical and chemical. What is mechanical plaque control method? Mechanical plaque control is the removal of microbial plaque and the prevention on the teeth and adjacent gingival surface by the use of toothbrush and other mechanical hygiene aids. What is chemical plaque control method? It includes the transport of antimicrobial agents to the oral cavity using dentifrices, mouth rinses, etc. to reduce and control microorganisms. Now I explain mechanical plaque control method classification. It has four types. Number 1, toothbrush. It includes manual and powered. Number 2, dentifrices. Number 3, interdental aids. It includes dental floss, toothpick, interdental brush. And last one is oral irrigation. It includes supragingival and subgingival. Here are some pictures of toothbrushes. Now I would like to explain historical background of toothbrushes. Number 1, mechanical cleaning of teeth can be traced back to ancient time. Number 2, evidence says that oral hygiene was practiced by Egyptians 5,000 years ago with the help of chopsticks. Number 3, excavation in Mesopotamia uncovered elaborate gold toothpicks used by the Sumerians around 3000 BC. Number 4, first bezel toothbrush was found in China during Tang Dynasty 1498. Number 5, one of the earlier toothbrushes made in England was produced by William Addis about 1780. Number 6, the first patent for a toothbrush was by H.N. Wordsworth in 1857 in United States. Number 7, during 1900s, celluloid handles gradually replaced before bone handles in toothbrushes. Number 8, natural animal bristles are also replaced by synthetic fiber, usually nylon bristles in 1938 by DuPont. Number 9, the first electric toothbrush was invented in Switzerland by Dr. Philip Guy Hu. Number 10, the first American electrical toothbrush in US called Broxident was released by Squibb in 1960. Number 11, General Electric introduced a rechargeable cordless toothbrush in 1961. And number 12 is Interplank was first rotary action electrical toothbrush which introduced in 1987. Now I would like to explain ADA specification of toothbrush. What is ADA? ADA means American Dental Association. According to American Dental Association, toothbrush length is 1 to 1.52 inches, surface area 2.54 to 3.28 centimeter, number of tubs 5 to 12 per row, weight 5 by 16 to 3 by 8 inches, number of rows 2 to 4 rows of brushes, number of bristles 80 to 85 per tubs. Now I explain ideal properties of toothbrush selection. Number 1, toothbrush should be able to reach and efficiently clean most area of tooth surface. Number 2, no single toothbrush is adequate for all patients. Number 3, proper brush provide easily accessibility to all of the mouth. Number 4, the small-handed brushes are often helpful. Number 5, easy for patient to manipulate it. Number 6, brushes should be compatible with recommended brushing techniques. Both natural and nylon brushes are satisfactory. Number 8, soft brush is recommended. And number 9 is should be replaced every 3 months. Here is my references. Well, I have covered the point that I needed to present today. Thank you all for being here today and taking the time to patiently listen to what I had to say. I wish you all have a blessed day, and a special thanks to our teachers and Access Dental School to creating and managing an incredible platform. Thank you all and good night.
Thank you, Asmatul Mahdiruni. It was a very nice presentation. After all the presentation, there will be a question answer session that will be more interesting. Please grab your pen and paper and be prepared. Now, our second presentation will be start now. The second presenter is Ilara Hussain Shanta, session 2017-2018, Sir Solimullah Medical College Dental Unit. Please, Shanta, share your screen and start your presentation. Shanta.
Thank you. Assalamu alaikum to all of my respected teacher and viewers, fellows, and moderator. My name is Ilara Hussain Shanta, session 2017-18 from Sir Solimullah Medical College Dental Unit. Here is my content to which I am going to present my presentation on mechanical plug control method. Manual toothbrush. This is manual toothbrush in which we have get 3 parts: head, handle, and in between head and handle it is called shank. In head we get a brushing plane which is made of by bristle, and bristle is made of by tubs. In the terminal portion of the head is known as toe, and this is known as heel. Handle. It is either thin or thick, straight or contra-angle. Contra-angle allows better accessibility and less stretching of oral tissue. This is handle. Brush head. Either long or short. Short head allows better accessibility to lingual and distal areas. Bristles. Bristle is made up by 2 or 4 rows of tubs. It is either natural or artificial. Natural bristles form from hawks frying, breaking, softening, loss of elasticity, contamination with microbial debris. Artificial filaments made of nylon or are superior. They are grouped in tubs which are arranged in 2 to 4 rows. The brush is either unitufted or multi-tufted. Soft bristles are more flexible, clean beneath gingival margin, and can reach further onto proximal surface. Bristles hardness is proportional to square of diameter. Diameter of bristles in ultra soft brush 0.075 millimeter, sub brush 0.2 millimeter, medium brush 0.3, and hard brush 0.4 millimeter. Ideal toothbrush. No ideal toothbrush in terms of shape, size, and handle. Toothbrushing method. In manual toothbrushing method, we have got 7 methods: horizontal toothbrush or scrub, Leonard method, vertical, burst method or circular, cleaning, modified bus method, Stillman method or vibratory, modified Stillman method or roll, charter methods, and method of cleaning with power toothbrush. Horizontal toothbrushing. Bristle placement should be horizontal on gingival margin. Motion should be scrubbed in anterior position direction, keeping brush horizontal. Advantage: easy to learn and best suited for children. This is horizontal toothbrushing method. Bus technique, most often recommended. Emphasize circular placement of bristle, adapting the bristle tips to gingival margin. This is gingival margin. Supragingival plaque and accessing subgingival plaque to possible extent. It make 45-degree angles. Technique: place the head of a soft brush parallel with the occlusal plate. Place the bristle at the gingival margin, establishing an angle of 45 degrees to the long axis of teeth. Exert gentle vibratory pressure using short back and forth motions without dislodging the tips of the bristles. Resorption to next group of teeth. Modified bus technique. This method differs from bus technique in that it has sweeping motion from cervical to incisor or occlusal surface. Indication: as a routine oral hygiene measure and intrasulcular cleansing. Advantage: excellent sulcus cleaning, good interproximal and gingival cleaning, good gingival stimulation. And disadvantage: dexterity of wrist in required. Technique: this technique combines the vibratory and circular movement of the bus technique with the sweeping motion of roll technique. The toothbrush is held in such a way that the bristles are at 45 to the gingiva. Bristles are gently vibrated by moving the brush handle in a back and forth motion. The bristles are then swept over the sides of the tooth towards their occlusal surface in a single motion. Brush position on the occlusal surface used with bus, Stillman, Chartas method. Palatal position in incisor. Intercircular position of the brush at 45-degree angle to the axis of the teeth. This is the method. Stillman method. Same stroke as bus, same angle as 45-degree. Filaments are placed half on sulcus and half on gingiva. Indication: gingival recession to clean large embouchures, remove plaque from cervical region. Modified Stillman method. Bristle placement as 45-degree angle. Motion: apply pressure as in Stillman's method, but vibrate brush and also move occlusally. Advantage: easy to master gingival stimulation. Chartas technique. Indication: individual having open interdental spaces with missing papilla and exposed root surface, for patients who have had periodontal surgery. Toothbrush modification: long and contoured handle, double angulation of head and neck, concave surface of the brushing plane, special indicator bands. Power toothbrush, invented in 1939. All power toothbrushes rely on mechanical contact between the bristles and the tooth to remove plaque. Interplaque rotational motion should be 4,200 RMP, Oral-B 2000 RMP. Rotadent, rotating brush that has single tip resembling a prophylactic brush. Motion: reciprocal back and forth motion, same with combined of both circular elliptical powered brush with shaped tips designed for interproximal cleaning. Indication: young children, handicapped patient, patient with prosthodontic or endoosseous implants, orthodontic patients, elderly patient dependent on care providers, patient on supportive periodontal therapy. Advantage: it increased patient motivation resulting in better patient compliance, increased accessibility in interproximal and lingual tooth surface. No specific brushing technique required. Uses less brushing force than manual toothbrushes. Brushing timer is incorporated in some brushes to help the patient in brushing for the required duration. Now, this is about dentifrice. Introduction: the use of toothbrush is usually combined with the dentifrice with the purpose of facilitating plaque removal and applying agent to the tooth surface for therapeutic or preventive reason. Aid in cleaning and polishing the tooth surface. Proper use of dentifrice can enhance the cleaning action of toothbrush up to 40 times. Can also be used as vehicles to deliver chemotherapeutic agents to inhibit plaque, calculus, or root hypersensitivity. Types of dentifrice: powder, paste, and gel. Ingredient: water 20 to 40%, silica, aluminum, dicalcium phosphate, and calcium carbonate abrasive agent, surfactant, sodium lauryl sulfate, gum and silica as thickeners. mint and peppermint as flavoring agent, magnesium aluminum silicate, colloidal silica, sodium magnesium silicate as binders, glycerin and sorbitol as humectant. Preservatives, alcohol, formaldehyde, dichlorinated phenols. 2 to 3% sorbitol, sodium saccharin, sorbitol, xylitol as sweeteners. Therapeutic agents 1 to 2% fluoride, humectant, glycerin, and sorbitol, other triclosan and stannous fluoride. Function. Abrasive agent acts as abrasive agent for cleaning and polishing objective. Polishing agent is used to reduce a smooth shining tooth surface that resists discoloration, bacterial accumulation, and retention. Surfactant to lower surface tension and penetrate and loosen surface deposit and stains. Humectant added to retain moisture, prevent hardening on exposure to air to stabilize preparation. Preservatives.
Sorry to interrupt. You have passed in 8 minutes, only 2 minutes left.
Preservatives to prevent bacterial growth and to prolong shelf life. Sweeteners to import a pleasant flavor for patient acceptance. Flavoring agents to make the dentifrice desirable, to make other ingredients that may have less pleasant flavor. Therapeutic agent for medical value, water, main transport medium. Recent development in dentifrice, toothpaste for children, whitening toothpaste, sodium bicarbonate toothpaste, and breath freshening toothpaste. Here is my reference from which I have taken those. Thank you all for give me this. Thank you all of you for hearing my presentation. Thank you.
Thank you, Shanta, for your wonderful presentation. This was very informative. Now we move forward to our last presenter of this session, Maimuna Noor, session 2017 to 2018, Chittagong International Dental College. To present her part of the presentation, please share your screen to all and start your presentation.
Thank you, moderator. Respected judges, Dr. Ganesh Puttu sir, Dr. Ankita Potecha ma'am, and Dr. Shahidul Islam Shahin sir, Professor Dr. Balaji Manohar sir, Professor Dr. Didarul Alam sir, and Professor Dr. Anupam Poddar sir, all the participants, moderators, and viewers who are watching these programs right now. Assalamu alaikum. Before starting my presentations, I would like to thank all the members of the Axis Dental groups and Professor Dr. Anupam Poddar sir for creating such an innovative program for us, and all the judges for sparing sometimes from their tight schedule. My name is Maimuna Noor from Chittagong International Dental College, session 2017-18. Today's my topic is mechanical plaque control method. Here is my contents, and today I will be discussing some points from these contents and which is selected for me. And these are interdental cleaning aids, under that dental floss, interdental cleaning devices, and interdental cleaning devices, under that interdental brushes, wooden or rubber tips, and oral irrigation, gingival massage, and disclosing agents. Then move on to my first slide, and this is about the interdental cleaning aids. Any toothbrush, regardless of the brushing method used, does not completely remove the interdental plaque patterns. So we should focus on the interdental cleaning aids because most of the periodontal disease and dental problems originate in the interproximal area. And here I added some pictures according to this topic. Then move on to my next slide, which is about the dental floss. It is the most widely recommended tool for removing biofilm for proximal tooth surfaces where the toothbrush can't reach. And here I added some pictures according to the different forms of dental floss. And the first one is the string dental floss, and second one is the power dental floss, and the third one is dental floss with holders. Now I will be discussing about the types of floss. There are different types of floss I showed. First one is twisted or non-twisted, banded and non-banded, thin and thick, microfilament and multifilament. According to the American Dental Association specification, there are three types of floss. First one, type 1, unbonded dental floss composed of yarn having no additives. Type 2, bonded dental floss composed of yarn having no additives. And type 3, bonded and unbonded having drug for therapeutic uses. Then my next topic is techniques of the flossing. There I showed two types of methods of flossing, string floss method and the circle of floss method. Now move on to my next slide, which is about the application of the floss. In this first picture, we can see wind 18 inches of floss around middle fingers of each hand and leaving 1 to 2 inch length in between them. In my second picture, we can see keep 1 to 2-inch length of floss dot between the fingers. And in third picture, we can see gently guide floss between the teeth by using a zigzag motion. Then third and fourth picture, we can see slide floss up and down against the tooth surface and under the gum line. Then move on to my next topic. And here I added some pictures about the wooden toothpick. Here in this first picture, we can see triangular wooden tips is inserted between the teeth and with the triangular portion resting on the gingival papilla. It is difficult to use on the posterior teeth and lingual aspect of the all teeth. And in this picture A, we can see the tip is used to clean subgingivally and reach into the periodontal pockets. And in this picture B, we can see the tip can also be used to clean along the gingival margins of the teeth and reach under the gingiva. And move on to my next slide, which is about the interdental devices. I added some pictures according to the interdental devices, such as interdental brushes, single tuft brush, and wooden tips. And my next topic is about the uses of interdental brushes and uses of single tuft brushes. Interdental brushes particularly suitable for cleaning large, irregular, or concave tooth surface adjacent to wide interdental spaces. And single tuft brushes provide access to percussion areas or isolated areas of deep recession and are effective on the lingual surfaces of mandibular molars and premolars. And here we can see interproximal embrasure spaces vary greatly in patients with periodontal disease. In this first picture, we can see embrasure with no gingival recession are adequate cleaned using dental floss. In the second picture indicated, larger spaces with exposed root surfaces require the use of an interproximal brush. And in the third pictures indicate single tuft brushes clean efficiently in interproximal spaces with no papilla. Then move on to my next slide. Cleaning of concave or irregular proximal tooth surfaces, dental floss may be less effective and interdental brush is more effective than the dental floss. Then I added some data according to the using of the dental floss, according to the survey of the public with American Dental Associations, which is published in 2017 October. Here we can see the bar chart. We can see a bar chart, and in this 16%, we see 16% of the people says that they always floss at least once a day, and 20% people says that only floss when they need to or when something is stuck in their teeth, and 8% people says that they do never floss. And move on to my next slide. According to the American Dental Association, the biggest reason for reported for not flossing, and here we can see 68.8% people don't floss because it's time consuming, and 20% people says that it was painful, and 11.3% people says that they find it gross. Then my next topic is about the oral irrigation. Oral irrigation is the targeted application of a pulsated or steady stream of water. The target of the oral irrigation is the loosely attached subgingival bacteria plug. A variety of tips can be used with an oral irrigator. One type of tip is subgingivally and at a 90-degree angle, and another is subgingivally. Then move on to my next slide. This is about the different types of irrigator tips. Here I added some picture according to this, and first one is jet tips, and second one is tip with soft tapered bristle, and third one is site specific tip, and the fourth one is tip with soft filament. Then move on to my next topic about the procedure of the irrigation I mentioned. And first one is pulsated. Irrigated is directed perpendicular to the long edges of the tooth. Then hydrokinetic activity started. Direct the jet tip towards the interdental area. Start on the low pressure setting and increase gradually. The first is the impact zone. The second is the flushing, and the third action is the lavage of irrigant. Then follow a defined pattern across the mouth. Maxillary arch first, then the mandibular arch, applying for 5 to 8 seconds at each interdental area. Then move on to my next slide. Here I added some picture about the procedure of the supragingival irrigations, and second one is the subgingival irrigation. Then my next topic is about the gingival massage. Massaging the gingiva with a toothbrush or interdental cleaning device produces epithelial thickening, increased epithelial keratinization, increased mitotic activity in the epithelium and connective tissue. Then move on to my next slide. Is about the disclosing agents. Disclosing agents are the solutions or wafers that stain bacterial biofilms on the surfaces of the teeth, tongue, and gingiva. Material used as disclosing agents are 2-stone, erythrocin, basic fission, Bismarck brown, first grain, mercurochrome, displug, fluorescent dyes. Then my last slide, but not the least, is about the procedure of the using the disclosing dice. Before the procedure, we can see the conditions of this thing, and after using the disclosing die, and after the procedure, we can see the condition of the teeth. Then summary. Everyone should require the regular use of a toothbrush, either manual or electric, at least
Sorry
once
to
per-
interrupt. Sorry to interrupt, Maimuna Noor. You have passed 8 minutes. You have only 2 minutes left.
Careful. Brushing method should emphasize access to the gingival margin of all possible tooth surfaces and extensions onto the proximal surfaces. Dental floss should be used in all interdental spaces that are filled with gingiva. Reinforcements of the daily control practices and routine visits to the dental office for maintenance care are essential to the successful microbial plaque control and long-term success of therapy. And here I added my references from which I collected my data. Newman and Caranger's Clinical Periodontology, 13th editions, and Essential of Clinical Periodontology and Periodontics, 3rd edition, and Principle and Practice of Periodontics, 3rd edition, and Textbook of Pediatric Dentistry, 3rd edition. And relevant pictures are collected from Google. And here I added a link from which I collect my survey data. And thank you for listening.
Thank you, Maimuna Noor. That was very nice and informative presentation. I hope some data will help us to judge. Asmatul Mahdi Luni took 6 minutes 50 seconds. Ilara Hussein Shanta took 8 minutes and 50 seconds. Maimuna Noor took 9 minutes and 5 seconds. Hope this will help our judges to judge the presenters. Now I would like to request Dr. MD Shahidul Islam Shaheen sir to start this question answer session and ask questions to the presenters. Sir? Sir? Dr. MD Shahidul Islam sir? Sir, are you here with us? Sir? Sir, I can't hear you. Hello? Okay, we could not connect him. Now I would like to invite Dr. Ankita K. Kotecha ma'am to participate in question answer session and to ask the questions.
Oh, my question to the first presenter, Asmatul ji, can you answer when to replace the toothbrush?
Asmatul, please unmute your screen.
Thank you, ma'am, for your question. Please repeat your question.
When to replace the toothbrush?
Ma'am, after 3 months.
Any other conditions? Is it so compulsory to use the toothbrush, utilize the toothbrush for the entire 3 months? What if something goes wrong before 3 months? What all things happens and which calls for a replacement? Any other signs to be seen in the toothbrush to consider a replacement?
Sorry, ma'am.
See, duration wise, it is correct. You should consider replacing the toothbrush every 2 to 3 months. Yes, it's 2 to 3 months, but it's not a hard and fast rule. You should look for the signs for the health of your toothbrush also. You should see for fraying of the bristles. If the bristles are damaged and they are frayed enough, that won't be as good enough to do the cleansing job, right? In that case, if the bristles are frayed or so, then also we should consider a replacement. We are not supposed to wait for 2 to 3 months correctly, like date wise. Okay. So the signs to be seen in a toothbrush to consider a replacement is fraying of bristles.
Yes,
and on your slide, I saw you wrote natural or artificial. Both the bristles works well. My question is which one?
Ma'am, nylon. Nylon is best for Ma'am, your question?
Slide says natural and artificial bristles both are fine.
Yes,
Right.
ma'am.
What are the drawbacks of natural bristles which led to the consideration or invention of artificial bristles? Any particular specification in bristles which are in favor of artificial bristles and not the natural bristles? A very important aspect of a bristle filament.
Ma'am, natural bristle are not always soft, and ma'am, are others bristle, ma'am, nylon bristle is, ma'am, preferable because it's homogeneity in nature. Then, ma'am, it's not, ma'am, broken.
It's okay not to answer. It's okay. See, out of the two, artificial bristles works well, right? Rather than natural bristles. The important aspect to look in bristle is the end. They should be round end. Natural bristles are never round end. They cannot be made round end. And even if they are made, they will wear off so easily because they are soft. Okay. And they are hollow. Their configuration is hollow, which leads to microbial contamination and accumulation. And that is why the bristles should be preferably artificial, which will be made round end, and they will be able to bear the wear and tear, the timely wear and tear. Okay.
Yes, ma'am.
So that's the drawback of natural bristles, which led to the invention and introduction of artificial bristles. The round end of the bristle is an important aspect to be considered in a toothbrush.
Okay, ma'am.
Well presented. All the best.
Thank you, ma'am.
My questions to the next presenter, Ilara.
Assalamu alaikum, ma'am.
Salam. I'm not sure if you mentioned the length of a filament while discussing the specifications of a toothbrush.
No, ma'am.
Do you know the length of the filament in a toothbrush?
On to 1.25 inches.
I'm asking length of the filament.
Sorry, ma'am.
It's 11 mm. Toothbrushes have tufts, right? And tufts are made up of filaments, bristles, right? That bristle length in a toothbrush is 11 mm. Okay. And if I'm not wrong, I noted during your presentation, you told no ideal toothbrush, right? No such ideal specifications of a toothbrush. Right? But when we discuss the specifications of toothbrush, it clearly mentions the length and width of a toothbrush head and the length of the handle as well. Right? There's nothing as thin or thick or short and long also works well. Thin and thick is also fine. It's not like that. The handle should be thick enough for the grasp. Okay, because grasp is another important aspect when it comes to toothbrushing. The grasp is what takes the job forward. Okay, it takes the job forward to make it more easy and better. Okay, so any ideal toothbrush has a specified length when it comes to adults, that is 6 to 7.5 inches. For pedo or junior cases, it may be shorter. And it's about the head also. Short head, you said it is good for access. Agreed, it's good for access. But toothbrushing is not only about access. It's about cleansability. It's more about cleansability after getting the access. So a short head in an adult case is not a good match. Okay, a short head works well for junior cases, pedo cases. But for an adult, there has to be a specific head size of a toothbrush. Do you know the head size of a toothbrush for adults?
Sorry.
It's very clearly mentioned in the ADA specifications. It's 1 to 1/4 inch length of the head. Okay. Earlier, we discussed handle. The length of the handle should be 6 to 7.5 inches. Now coming to head, the second part of toothbrush. The length of the head is 1 1/4 inches and width is 5/16 to 3/8 inches. Okay. So these are the specific values which do exist to be considered for making an ideal toothbrush. Okay. All the toothbrushes will not be of these dimensions, of course. But when we talk about ideal, there has to be some values which fits in the criteria for an ideal toothbrush. Okay? So these are the values. Talking to the third and final presenter, good one. All the best to you, Ilara. Talking to Maimuna.
The ma'am.
Can you tell me the name of the motion of flossing? Can you name that motion of dental flossing?
Oscillating motion or rotating motion?
Ma'am, I'm talking about floss. What is that motion used during dental flossing? There is a particular name.
Ma'am, back and forth motion.
For flossing, dear, dental floss cannot be used in back and forth motion. Nothing will be remaining in the.
Ma'am, rubbing motion?
See, your slide said zigzag. Okay, your slide said zigzag motion. I wonder how to perform zigzag motion. The motion for flossing is clearly mentioned. It's a sawing motion or a shoe shine stroke. Have you ever noticed carpenters working with their saw? It's always okay. So that is the particular name for the technique, how to perform flossing. So this is a very important terminology. It helps to teach the patients in your clinical setup. You have to demonstrate the motion. You cannot just tell them zigzag motion. Zigzag motion, I am personally doubtful about it. But yeah, it's better to be considered calling it sawing motion or a very layman term, shoe shine stroke. You must have observed cobblers working on polishing the shoes.
Yes,
right?
ma'am.
The shoe shine stroke. Okay, that's the way to use dental floss, because what happens when you use dental floss incorrectly, it leads to. Do you know what it leads to when dental floss is used incorrectly? It leads to floss cuts. Okay. And my very important question to you is when to floss. That was missing in your presentation. When to floss. Important from the clinical perspective.
If the because toothbrushing does not reaches the interproximal areas, so most of the organisms are found in the interproximal area, which causes various type of periodontal disease and dental disease. That's why dental floss is needed.
That is why to use. I am asking when to use. The timing of using a floss. Like we have
either night but once a day.
Okay, very clear answer. Before the toothbrushing or after the toothbrushing? Is it before the toothbrushing or after the toothbrushing?
After the toothbrushing. Sorry, before the toothbrushing.
Why?
Before. Because in toothbrushing, interproximal area, defined types of food particles are stuck in the interproximal area. So we should first need to clean the interproximal areas with the dental floss.
So do it later on after toothbrushing. If it's all about interproximal cleaning, then it shouldn't matter. You do it before brushing or after brushing. Anything else apart from this?
After eating, before the brushing.
Okay. See, the answer is before the toothbrushing, because when the toothbrush is used, it's used with a dentifrice, okay, and preferably fluoridated one. So if the interproximal area is cleansed first, that is before the toothbrushing, then this dentifrice and the material, the content of the dentifrice will be able to reach the interproximal area. Okay. Conversely, if we see the opposite situation, you brush first and then you do the floss, then the dentifrice will not be able to reach the interproximal area. Okay. So to achieve complete interproximal cleansing, flossing should be advised before toothbrush. Okay. This is one very common confusion. Flossing is before toothbrushing and mouthwash, using mouthwash is after toothbrush.
After toothbrush.
Well presented and all the best. That's all.
Thank you, ma'am. Thank you for this interesting and informative question answer session. Now I would like to request Dr. Ganesh PS sir to ask his question to the presenters.
Thank you, ma'am. Suraya, ma'am. Dr. Ankita has covered almost 90% of the questions I wanted to ask. So I'll just give a few pointers and discuss with the participants. I think the first person to present was Smatul. Hello.
Yes, sir.
Your
Hello, sir.
presentation your presentation was good. You started off well. You talked about plaque control, the reason behind why we need to do mechanical plaque control. But you missed out on, telling us why mechanical plaque control is considered the gold standard of plaque control, right? You started off well, but you didn't end properly. I was waiting for your actual presentation to start. It was almost like an introduction to mechanical plaque control. I was waiting for you to actually get into the, the meat of the thing. Talk more about mechanical plaque control, why plaque control is significant, what happens if you don't do plaque control. Because you were, giving the introduction about plaque and everything, you were giving the disease process you were giving, and then the treatment you started off. But you didn't round up your presentation properly. It was like it ended abruptly. I was waiting more from you. I was expecting more from your presentation. So next time, make sure that, go, completely, end with a well-rounded presentation. Or were you, paucity of time? Was there any paucity of time where you, prepared to, finish it before your time? I don't think so. Most of your slides were pictures, right? You didn't have a text-heavy presentation. So you could have a lot of time to do the complete job. It was like 70 to 80% of your presentation only was there. You didn't complete the rest of the presentation. So I felt that your presentation was incomplete, right? So next time, make sure that you do a proper job. Take your time, do a proper job. Conclude it properly.
Okay,
the initial and the middle part were good, but the concluding part was, lacking in it. So that's my tip to you. The second one was Dr. Suraya, right? Is
Thank
she
you,
there?
sir.
Thank you.
Thank you. Thank you, sir. Thank you for your kind words.
Dr. Suraya is there?
Moderator.
Okay. The second presenter, is she there?
Second person. Shanta. Ilara Hussain Shanta.
Ilara.
Yes, sir. Assalamu alaikum, sir.
Doc, this is a presentation, right? You should present. You shouldn't read your slides. I was waiting for you to start presenting. You were simply reading. Your presentation was exhaustive. I have to give you to that. It was, it was well covered. You covered almost everything. There was nothing left to the imagination, but you are reading line by line, word by word. So when you talk about a presentation, you're supposed to, all that information is already there on the screen, right? We can read it. You can read it. Everyone else can read it. You are supposed to offer something which is not there. You are supposed to give a presentation. You have to present a slide. You're not supposed to read all the entire slide. That is why you ran into some timetable. If I'm not right, you couldn't complete your presentation, right? Because you were reading all your slides continuously. So next time, make sure that you present. And then there were a lot of spelling mistakes in your slides. Please correct your spelling mistakes. I think Ideal Toothbrush, a lot of spelling mistakes I noticed in your slides. So go through your slides before presenting. Make sure that there are no spelling mistakes. Arrange your slides properly. And make sure that you cover all the topics. You went exhaustively into toothbrushing, but you couldn't, go into the rest of the oral hygiene aids. You left out flossing. You left out interdental toothbrushes because you are only concerned about toothbrushes. Again, and you went completely, you covered toothbrushing, but you left out all the rest. Like you did only 50% of mechanical plaque control. you couldn't complete the rest of the mechanical plant control. And again, the significance of mechanical plant control. Why we should do mechanical plant control? What is the point of doing mechanical plant control? What is the advantages and disadvantages of toothbrushing? You could have ordered all this instead of, just talking about just the toothbrushes, which you could have finished in 1 or 2 slides. So next time, make sure that your presentation is a bit more interesting, that you actually present instead of reading all your slides. Thank you. And where is the third person, Maimuna? Can we move on to the
Yes, sir,
third presenter?
Yes, sir, Adav.
Yeah. Congratulations, Doc. I very much enjoyed your presentation. You went on a completely different tack. You knew that you are the last presenter. You knew the other two would be talking about toothbrushing. So you started off with floss. You covered all the rest, which they did not cover. I really enjoyed your presentation. But you could have talked about the significance of mechanical plant control, right? Your topic is mechanical plant control. Nowhere in your presentation you talked about mechanical plant control. You went into the nitty-gritty of mechanical plant control. All the subheadings you went into, but the main topic, mechanical plant control. Why mechanical plant control? What is the significance of plant control? Somehow it was missing, it was lacking. Other than that, your presentation was fine. Your, all your slides were fine, all your pictures were fine. But the significance of it, why we need to do mechanical plant control, why it's considered the gold standard, what are the other options if mechanical plant control fails? And of course, nowhere in your presentation you touched about toothbrushing, which you could have, at least given 1 slide. You didn't need to go into all the detail about toothbrushing. You would have started off with flossing and everything else, but you could have just touched upon, toothbrushing instead of just growing for, interdental aids, right? So next time, make sure that you also talk about toothbrushing when you talk about mechanical plant control, and you talk about its significance, why it's important to us, what happens in the case of there is no proper mechanical plant control. Thank you.
Thank you, sir. Thank you for your kind words. Thank you for your kind words. Now I would like to request Professor Dr. Muhammad Shahidul Islam Shaheen sir to discuss about this program and today's session. Sir, sir,
thank
are you here?
Thanks. My first comment about first speaker, Asma. His presentation was nice. And thank you. I appreciate your slide presentation and your attitude in the delivery. It's excellent. But you ended in very short. You didn't cover all the topics completely. But it was good and better also.
Thank you, sir.
I have one question. When you live in a remote area, very remote area, there is not toothbrush or toothpaste or other things is not available. Which is your recommendation to control the plaque?
Sir, ideal is salty.
Ideal is not available here.
Warm, salty water. Salt. Sir,
I like to know mechanical.
Water.
I like to know mechanical. Any other mechanical option?
Any other?
Thank you.
Thank you, sir.
I like to move on with second speaker. Thank you, Asma.
Thank you, sir.
I like to move with second speaker now. Ilara. My Ilara.
Assalamualaikum, sir.
Walaikum salam. Thank you. Your slide presentation was excellent, but I mention again, you had to present the topic, not to read the slide. Otherwise, you covered the area, all the area excellently. I have just one question to you. Is it possible to control the plaque without paste, gel, or tooth powder? Thanks. Is it possible?
जी sir, chemical plaque control method.
Without any chemical agent, is it possible to control the plaque?
Sorry sir.
Thank you. Thank you, Ilara. Thanks for your best presentation. I like to now move with the third speaker.
Assalamualaikum.
Walaikum salam. I appreciate your presentation with all the area, your slide presentation, and your good delivery, attitude, and gesture also. Which is your recommendation in between interdental brush or floss? Which is your recommendation?
Sir, if there is no gingival recession and the gum is healthy, then we recommended the dental floss. And if there is a large abrasor due to the gingival recession, then we recommended interdental brushes.
Okay, thank you. Thank you all.
Thank you, sir. Thank you for your questions, and it was very informative. Now, I would like to invite Professor Balaji Manohar sir as a guest of today's session to share his experience and hear his attitude towards this.
All young students, all three girls here, Aswatul, Maimuna, and Sarah, they have made a lot of effort to.
Sir, your sound is not clear, sir. Balaji sir,
Oh,
sound
okay,
is not clear.
Is it better now?
Yes, yes.
Yeah. First of all these three young students, Aswatul, Maimuna, and Ilara, they have made a lot of effort. I think they must be in third BDS right now to make this presentation and present in front of teachers as well as foreign judges who are sitting here. I think Ganesh also will agree that when we were students, we didn't have such. So,
Didar, please. Didar, please unmute.
So,
Dr. Didar.
congratulations to you all. The judges have already discussed what you have not done and what you should not do. The Dr. Ganesh, Dr. Ankita, and Dr. Saidul, all of them have told you. Plaque control is one of the main thing which has to be done for periodontal therapy. We all tell about scaling and root planing, but when scaling and root planing is being done, the treatment doesn't end there. If the patient by himself or herself is not able to maintain the oral hygiene by the plaque control methods which are being taught to them by you as dentists, the periodontal treatment is not going to have any effect. Any plaque which is going to remain back is going to bring back the disease. So it is very important for the patient to be taught about the plaque control. And you have discussed about mechanical plaque control, which is the mainstay of the therapy. When you are using these interdental aids, how to prescribe these interdental aids? Each interdental aid has to be prescribed in site specific as well as patient specific. You have to know what is the type of embrasure. So whether in that embrasure area, whether you should give a floss or whether you should give an interdental brush. All these things are very important for you to understand so that the plaque control can be maintained. If the embrasure is open, there is no contact between the teeth and you prescribe a floss, it is not going to work. You will have to prescribe an interdental brush in such areas. So you have to understand the nitty-gritties importance of the different types of mechanical aids which are there, so that the patient can be benefited. So I hope you all will take more interest in perio and learn more of perio. Dr. Anupam is there, and now PG also is starting. So maybe in another 2 years, 3 years, you all will join perio PG and make the country proud, make yourself proud, make your teachers proud. Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir, for your wonderful comments. Thank you all. Congratulations to the participants for wonderful presentation. Now, I would like to invite Dr. Ankita K. Kotecha ma'am to give her presentation for much more understanding on this topic.
Honestly speaking, these presenters have well covered all the aspects, but still I feel what they missed out, maybe 1 or 2 points. One point I would like to bring to their notice is to teach the sequence of toothbrushing. You all discussed the toothbrush methods, but what was missing in those methods is first is the number of strokes in each toothbrush technique, and the second is the sequence of toothbrushing. So the number of strokes when it comes to any toothbrushing technique, let's say Bast or Charteris or Stillman, we have to count at least 5 strokes. Okay? So I'll just be talking about few clinical points only rather than theory. Lots of theory discussed till now. So let's just talk something practical. So it has to be at least 5 strokes. It's in the range of 5 to 10. Okay, any number that suits. And then talking about the sequence of toothbrushing, we start from distal molar, we come in the front, and we go on the other quadrant, right? But there is one thing we should be observant about is we should change this sequence. For example, if we start from the mandibular right, okay, then the next day we should start from mandibular left, because what happens with the patient personally, the person who brushes the teeth, by the time he or she reaches the last sextant or the segment, he or she feels tired or fed up of it, honestly. So the last segment is always under-covered, okay? It's not cleansed up to the mark. And that is why this is an important thing to be followed. The sequence of toothbrushing should be variable. We should adopt a different sequence every time so that no area is left under cleansed or improperly cleansed for a longer duration. Otherwise, that area will start with some or the other periodontal problems. Okay, and talking about the few techniques, there is one technique which was less discussed in today's presentation, and that is Charteris technique. If you read the technique, Charteris technique, there are actually 2 brush positions, but the textbook only discusses 45-degree angulation. Okay? That's popularly discussed in all the popular textbooks which we read. But historically speaking, about this Charteris technique, when it was introduced, there were 2 brush positions. One was 90-degree position, which was mainly indicated when there were interproximal open spaces for more embrasure cleansing. Okay, 90-degree toothbrush position. But the popularly discussed method is 45-degree angulation, which we follow till date also. Okay, so these are the few points I felt which were not discussed in today's presentation, and I thought of bringing it to the students' notice so that they are benefited. And this is from clinical perspective also. And that's all from my end. I'll end my talk with one important reference the students will be benefited from, and that is Wilkins textbook of dental hygienist. It's not a periodontology textbook, it's dental hygienist textbook. If it's available in your library in your country, do make an effort, try to read Wilkins textbook of dental hygienist for this particular topic. Okay, this reference is really having wonderful data on this particular topic. Okay, so I hope you will go through this reference book and you all be benefited. And for any other queries, you know, I am available on my YouTube channel, Dental Studies Simplified. You can come over with any of your dental queries. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am. This was very impactful. Now, I would like to invite Dr. Anupam Poddar sir to inspire the students and say something about this program, and especially for this season.
Thank you, Surya Rahman Papri, for your wonderful moderation of today's session. I am very much enjoyed today's session. The three presenters, Asmatul Mahadev Launi, Maimuna Noor, and Ilara Hossein Shankar, all are doing his life best. I am very much enjoyed this today's session and the today's discussion. Our judges is Ganesh Priyar sir, Ankita Kukutasa ma'am, and Shoaib Islam Shaheen, and Professor Dr. Balaji Manoj sir. They discuss everything in plug control method, mechanical plug control method. Hopefully, our students who enjoy this, and it will be helpful to our student also in our general dentist, also our general people who see the episode, and hopefully our another guest, Ahmed Jadul Alam, is a keeper, is a departmental head of paleontology and oral pathology of our southern side of our country, the Borishal Medical College Dental Unit. You do some input their students about the plug control method, and I requested Dr. Didar, he's my friend. He do this his student correctly, and full his students will enjoy this session, and I am very much thankful to our accidental school. Just they are doing the very nice interesting session. It will be very much enjoyable and very much public oriented and student oriented, and they feel that this is a nice session, and hopefully they organize next another interesting sessions that will be our helpful to our students. Thank you, Dr. Papi.
Thank you, sir. Thank you for your kind words. Thank you so much. Thank you so much, our guest, our honorable supervisor, guests, judges, and presenters. This was an amazing session. We have learned a lot. Thank you so much. Again, I would like to congratulate to Group Jinjaiva for their presentation today. With this, our session ends here. Stay tuned for our next session on Friday at 10 p.m. Stay connected, stay safe. Signing off from today's program, I'm Dr. Surya Rahman Papri, intern, Dhaka Dental College and Hospital. Thank you. Thank you.
Thank you, Balaji sir. Thank you, Ganesh sir. Thank you, Ankita ma'am, for his nice cooperation to us. I hope our students enjoy this session.
We enjoyed it.
I hope you will help us in next any episode, and we are trying to flourishment of the paleontology in Bangladesh. Only 3 to 4 periodontists in Bangladesh, but whereas in your country 7,000 plus periodontists in India. But so I am trying to develop this subject by developing different type of programs. That is for the student awareness. This is the paper presentation, and for the public awareness for Sunday night with periodontist in every Sunday to do, and single episode by Professor Dr. Anirban Chatterjee in public oriented discussion about the periodontal disease. This type of program I will continue for a flourishment of periodontics in Bangladesh. So I hope you will help us for flourishment, and thank you, sir.
Thank you, sir.
Thank you.
Thank you.
Thank you, Balaji sir. Thank you.
Thank you.
Thank you, Shoidul.
Thank you.
Thank you all.
Thank you all.
Leader. Thank you. Shwedu, thank you.